He had an MRI this morning at 6:15, and right now he's picking up the disc from it. Blood work done already. The next appointment will be with his neuro-oncologist. Our hope is that we find out if he qualifies for the clinical trial. And our next appointment is at 2. He has to register for radiation and then get fitted for his radiation mask, and then they go through a simulation which just kind of helps him know what to expect when he gets the radiation, which should start next week.
You'll get radiation Monday through Friday. It's usually 6 weeks. Yes. So the Temodar is oral chemo. You'll take it by mouth, and that's going to be every day while you're on radiation. 7 days a week, so 42 days total. Okay. We like for patients to take Temodar at bedtime because that way you take it, you go to bed, and you have less side effects. The most common side effects of Temodar and radiation are fatigue. The second most common side effect is nausea, and that's why we give the Zofran 30 minutes before. It can lower your counts. So while you're getting chemo radiation, we will check your labs once a week. Fatigue tends to be their long-term struggle. Some patients do have some short-term memory issues, become a little more forgetful, a touch of what we call chemo brain.
You can see there's been slight growth since the end of March, which you haven't had treatment since then. Yeah, it's not surprising, and it doesn't change what we do. First, I'm going to start with the flare image. So this is before they inject the contrast enhancement. And so we're going to compare the one from 327 to the one from earlier today. Nose, okay, that's front. This is the back. The R denotes the right, and this is the left. And where we see the abnormality is when we get up towards the right temporal lobe. You can see that there's this bright white kind of fullness that you see on the right side that you don't see on the left. Yeah. And so as we work up, we can see that that bright white and fullness is still there and crosses over to the left side of the brain. It's very common for glioblastoma to do that. It likes to track along the white matter track, but this bright white change around here, so some of it's swelling and some of it's tumor. Okay. This is the old one. Okay. It looks like there's a bit larger of a volume that's affected by that bright white change. And so that's what the radiologist pointed out as well. So yes, there is some blood in that area. That being said, there is area of true contrast enhancement. What's not normal is to see it out, like extravasate out into the normal brain tissue. And it's more prominent. I wouldn't say that it's
just spread out wider.
It's just, yeah, it's developed over time.
Okay.
Yeah, see, it looks a little bit larger here than here. Okay. That's come back, so you're unmethylated, so there are more clinical trials. When it's unmethylated, that gene can still be active.
I'm going to inhibit the...
But we know that it counters some of that. That being said, we still treat people who are methylated or unmethylated with Temodar, and there's some demonstrated benefit with Temodar, but it's not as marked. The Atezo is for sure. These ones are other options. You have to make a decision now if you're going to do the atezolizumab trial versus hold out. Every medicine you take has a different side effect profile. My concern with CBD oil is that most CBD oil has at least some component, even if it's small, of THC, and that's the compound that can make people fatigued and feel more cognitively blunted. And in our patient population, we're already dealing with not only the brain tumor, but going through active therapy. I don't recommend that. Okay. There's lots of different factors that weigh into how someone dies. And so I think by dissecting every variable, I can't tell you how long it's going to be until this grows back. What I recommend to all my patients is you talk about things like living well and advanced directives right off the bat. And we have people that hear the same things you're hearing now and need to defy our expectations. So one of the most important factors that we have, and it is included in every clinical trial to stratify patients in terms of how well they do, is what their functional status is. So how good they look, how well they're functioning in day-to-day life, how strong they are.
And you're awesome.
And you are excellent, right? You're at the top of the crowd.
2 weeks is a T-cell infusion. You have infusion appointments. And so you'll be getting a lab checked on the 3rd week of that cycle, and the 4th week of that cycle. Scan is every 8 weeks.
Part of my frustration with not knowing about his insurance today, and the reason that I spent most of my day on Monday trying to find out, is if he's not in this clinical trial, we're not staying here, because his standard of care treatment could be at home in Georgia. And we have 3 children, right? Okay. So we're headed to radiology now for him to be fitted for the mask and to do a simulation of the radiation. And we still don't even know if he's going to get into the clinical trial. I don't want to go through the process of him doing all the radiation stuff to just be turned around and told, oops, well, you don't actually qualify because of the insurance.
We're going to treat you for glioblastomas of the brain. Yeah. There's early reactions. So these are ones that happen during treatment or 6 weeks or something after. Okay, so spinal cord or nerve damage causing loss of strength, feeling, or coordination, damage to the eye or optic nerves causing loss of vision, ear damage causing dryness of the ear canal, fluid collection in the middle ear and hearing loss, pituitary gland damage requiring long-term hormone replacement. That may be.
Yay!
That's not walking.
Oh, there we go.
There it is. Oh.
Dada.
Yay!
Meanwhile, in Augusta, our family, friends, and neighbors were rallying together. Our church put on a live stream on Easter morning so that we could join in on the service.
I got a telescope. I got a red valley mirrors.
Nice.
It's the same one.
See the bubbles? You like the bubbles so far? I see.
I got that part.
Nice. Good job.
That's good. It's fine. I love to do it. Wow.
It's almost listening.
Friends wore blue in honor of Nick for his first day of radiation, chemotherapy, immunotherapy, since blue is his favorite color.
With being on temozolomide, the idea is that it's better tolerated, but some people do still experience fatigue with it, okay? What you need to do is try and keep your energy level up as much as possible, and that means even if you don't feel like it, you gotta get up and walk around, okay? Keep snacks around the house and just force yourself to do little snacking, okay? Because the idea is that when you expose people to chemo and radiation, that's oxidative stress you're putting the cells under. So sure, maybe less antioxidants. That's the one thing that we would argue. Okay. You'll find brain cancer patients operate a little bit differently than other kinds of cancer.
When we spoke originally, we talked about the larger pool number, which was like 50 people who had been part of it, and then that a little over half had come off of it for one reason or another. Out of those people who've come off of it, were the majority coming off because it wasn't working?
I'd say maybe half. No, it can happen, and we've seen them at various stages.
Okay.
From very early on, and we've also seen it much later, to where maybe they were closer to finishing therapy
Right.
altogether. 25%, then it's considered tumor progression. When we get that first MRI, it can look worse because you've had all this treatment, and that would just serve as a new baseline. If you're feeling well, we just continue on.
The tumor used the methylation status to recover for radiation therapy or for chemotherapy. The mutations that are identified, that are in the tumor right now, are not mutations that we are using for treatment, H2.
It would have to be.
Told you. Wow! What song is that? Lincoln? You are my sunshine, my only sunshine. You make me happy. Stars are bright. You never know, dear, how much I love you. Please don't take my sunshine.